Good afternoon, everyone, and thanks for joining us today. For most people, this time of year signals that it's time to start preparing for Halloween or Thanksgiving, but for public health, it signals that we need to start preparing for cold and flu season. And as we move into the colder fall and winter months, activities tend to move indoors and gatherings increase as the holidays approach. As we know all too well, this creates the perfect environment for respiratory viruses to spread. This cold and flu season will be our first without public health restrictions since the winter of 2019-20. And we expect to see both influenza and COVID-19 circulating simultaneously, in addition to other respiratory viruses. Our priority is to reduce the spread of these viruses and to preserve healthcare capacity by preventing severe illness and hospitalization associated with many of them. Remember, we all have the tools to stay healthy and reduce the spread of illness, keeping in mind the trusted public health adage of people, space, time, and place. But our most important tool is, without a doubt, vaccination. We are launching a campaign for COVID-19 vaccination, outlining new recommendations. A fall/winter dose of COVID-19 will be important for all those who are eligible. If you are aged 5 and older, and it has been at least 20 weeks since your last dose of a COVID-19 vaccine, you should make an appointment to receive your next dose to protect yourself for fall and winter. This is regardless of the number of booster doses you have previously had. For most children aged 5 to 11, the fall and winter dose will be their first booster dose and third dose overall. For those aged 12 and older, any booster doses administered on or after Wednesday, September 21st, is considered your fall or winter COVID vaccine. If you had a booster dose before September 21st, wait until 20 weeks has passed to book your fall and winter dose. The evidence shows that a longer interval of 20 weeks between doses provides more lasting protection against severe disease than a shorter interval, hence our recommendation. And recommendations for our youngest population, those aged 6 months to 4 years of age, have not changed. They are still eligible for their primary 2-dose series at this time. We now have a new vaccine product authorized for use in Canada. Moderna's Spikevax bivalent COVID-19 vaccine provides specific protection against Omicron, which is the COVID variant currently circulating across the world and here in Newfoundland and Labrador. While the vaccine is approved for those aged 18 and older, the National Advisory Committee on Immunization has made an off-label recommendation that individuals aged 12 to 17 who are at high risk for severe COVID-19 disease may avail of the bivalent vaccine. Newfoundland and Labrador will receive initial shipments of approximately 63,000 doses of bivalent vaccine this month, with more to follow. Because the vaccine will be in limited supply initially, at this time we are offering bivalent vaccine to those at increased risk of severe illness from COVID-19. We will expand this eligibility when we have sufficient supply, which we hope to be able to do in the very near future. At this time, the following groups are eligible for the bivalent vaccine in Newfoundland and Labrador: adults 65 years of age and older, residents of long-term care facilities or congregate living facilities for seniors, individuals 12 years of age or older with an underlying medical condition that places them at high risk for severe COVID-19 disease, adults in or from First Nations, Inuit, and Métis communities where infection can have disproportionate consequences, adults in racialized communities or marginalized communities disproportionately affected by COVID-19, and residents of other congregate care settings such as shelters, group homes, and correctional facilities who are 18 years of age or older. The bivalent vaccine will be available through participating pharmacies and physicians starting September 21st, and please check with your pharmacy or physician to book. We have asked that pharmacists and physicians help to preserve the initial supply of bivalent vaccine by ensuring that they have a vaccine clinic fully booked prior to ordering the vaccine. So please be patient with pharmacy and clinic staff as they help us through this early rollout. Regional Health Authority immunization clinics are ongoing, and appointments can be booked by visiting our COVID-19 website and selecting vaccines. You may need to check periodically for availability, as appointments will be added continuously, as has happened in the past. Clinic appointments for the bivalent vaccine will start on September 21st. Regional health authorities will also begin to offer vaccine to residents in long-term care and personal care homes and other residential settings next week. We have seen tremendous cooperation from Newfoundlanders and Labradorians in making the choice to be vaccinated, and we hope to see that continue as we work to protect one another and preserve our health system capacity. Please get the COVID-19 vaccine you are eligible to help us put up the best defense we can against COVID-19 this year. Thank you very much, and I'll now take questions from the media.
Dr. Fitzgerald, I'm wondering, when do you expect that you'll be able to roll the bivalent vaccine out to a larger group? I know, for example, Ontario was saying by the 26th of September, they think they'll have enough supply to start with everyone.
Yeah, so we're certainly looking at that right now, and you know, it depends on how much supply we get, obviously. We've had a very good response with vaccine uptake, so we anticipate the same will happen, you know, just based on previous experience. And however, lots of people have had infection recently, and so some may want to wait for, you know, 3 months or so before they get that vaccine. So we're not, it's a little bit difficult right now to gauge what the uptake will be. So we want to see that initial uptake and see what will come from that. And hopefully over the next couple of weeks, we'll be able to put more information out there about expanded eligibility.
Are the old vaccines still available, and if so, what criteria would you suggest people go by in terms of getting those?
Yeah, so anybody right now, so, you know, for anyone over the age of 5, basically should be getting a booster dose if it's been more than 20 weeks since your last vaccine, and you've completed a primary series, of course. So for children, that option will be Pfizer at the moment, and for anyone over the age of 18, then, you know, that option is to get the original, or what we call the ancestral strain, unless you have medical issues that put you at higher risk for severe disease, in which case you would be able to avail of bivalent.
How are you going to manage the like, for example, if I'm calling up my pharmacy and I'm booking an appointment, or I'm going to the regional health authority clinics, are there going to be separate appointments for bivalent versus regular for people who want to, like, some people may decide, you know what, I want to wait till I'm able to get one, and I don't want to go and get the OG variant?
Yeah, so currently, you know, work is being done right now, and we expect probably by the end of the day that there will be appointments available for the regional health authorities through the Pomelo booking system that will indicate bivalent vaccine appointments. With regard to pharmacists, of course, that will be, you know, they'll have to manage that on an individual basis as to how they would organize their clinics for vaccinations.
What are the overall uptake numbers in terms of third doses in the province? I know the online portal mentions 1 or 2. What percentage of people have had their third?
Yeah, I knew you were going to ask that question, so hang on. That's a lot of information, and it's really tiny, so be patient. So overall in the general population, it's like 56%, but of course that's in the whole population. If we're talking, for example, in the 70 to 79 age group, it's like 95%, and in the 80 plus, it's 89, almost 90% uptake, and then almost 80% in the 60 to 69 age group. So, you know, in those age groups where we know that COVID-19 can have a disproportionate effect, you know, can cause more severe disease, then certainly we're seeing good uptake of the booster. But we would like to have everybody get a booster. We know that, you know, having that third dose in particular is quite protective against severe disease, and for a little while is protective against transmission. And, you know, so we want to be able to reduce the numbers that we see through a surge in the fall and reduce hospitalizations and severe disease, obviously.
Can you explain a little more of this off-label recommendation for people aged 12 to 17? Because I know some people might be a little nervous getting a vaccine that maybe the recommendation from the company is that it's not for that age. Can you explain that a little bit?
So it's not a recommendation from the company. It's basically Health Canada authorizes the vaccine to be used in a population, and then the National Advisory Committee on Immunizations makes recommendations as to how they feel the vaccine could best be used. Certainly for people aged 12 to 17 who have medical conditions that may put them at severe risk for or at risk for severe disease from COVID-19, making sure they have protection specifically against Omicron when that's the circulating strain would be very important. What we know about this vaccine is that, it's an mRNA vaccine. It's the same as the vaccine that's been out there all along. The only difference is, the coating on the spike protein that is in the vaccine. So the technology itself, the type of vaccine that has been there has been used before and has been used in this age group before. It's just that the dosage has been used in this age group before. It's just, when companies submit, they submit based on, the studies that they've done and the information that they have. And so that's what Health Canada bases their assessment on. But there are many, many, many things that we use that are what we call off-label, which means, we use them in situations where they may not have been originally recommended, but over time we have enough experience and confidence in using that product that we know we can use it safely in those in an area different than what was originally recommended.
Can people expect to see this sort of campaign become the norm in every fall and winter now in terms of getting a COVID vaccine every fall?
So it's a little difficult to say at this point. Certainly it's looking like that could be the way that we have to go with it. We know that immunity does wane over time from the vaccinations and that COVID is quite good at mutating. So, we need to keep a close eye on that and see where exactly it goes. But I think at this point we're still learning as to what the long-term strategy will have to be, to live with COVID.
So just going back to the numbers of people there's still about half the population who hasn't even had a third dose. How worried are you that there may be some fatigue setting in and, many people have been able to get a third dose and just haven't, and now we're offering fourth doses to people. How much concern are you that some people may just not, they just say, I'm tired of getting these vaccines, I'm done with this?
Yeah, I think, we're all aware that vaccine fatigue or that I think COVID fatigue in general is sort of setting in for some people. I think what we have to remember is that over the spring and summer, a lot of people got infections and so they were waiting. And a lot of people have been waiting to see what will happen with the fall. So, I hope that what we'll see now is an increased uptake in the vaccine. And there is this benefit of hybrid immunity where, if you have immunity from the vaccines as well as immunity from infection, that can be beneficial as well and helps to decrease severe disease. However, that immunity wanes as well, so we want to make sure that people are getting out there and to get the booster. So it is really important, and that's why we're positioning this now as a fall and winter booster so that people are protected for what we anticipate will be a fall surge as people move back inside, and who knows what will happen over the winter. We could see another surge later.
Are you expecting to release a sort of a staged loosening of priorities as you did in the first go-around of vaccines?
I don't know that it'll be that, we don't anticipate that it'll be that structured as it was in the beginning. I think, once we know that we have a steady supply of bivalent vaccine coming in, then we'll be opening it up a little more broadly, obviously, but we don't know exactly when that supply is going to come, and so that's why we're encouraging people to get a booster, whichever booster you're eligible for at this point, because we know that even a booster with that ancestral strain, it still gives you really, really good protection against severe disease. So important, I think, regardless of what booster you can get at this point, it is important to get boosted. And we anticipate that we may see a surge in the next, into October. So you want to have it in your system a little while before, so that you have a good immune response mounted.
This changing criteria means there's going to be a lot more people who are now eligible for booster shots. Do the health authorities have a plan to ramp back up, and because recently they've been scaling back the number of clinics that they've been offering?
Yeah, so I think what we'll see is as clinics, they've gotten quite good at this now, and as clinics have, as they see clinics fill and as they see the need for more clinics, they will certainly add them in. The health authorities have lots of experience through flu as well as previous COVID campaigns at being able to ramp up vaccination clinics as they need to, so we have no concerns that they'll be able to do that again.
You mentioned anticipating a COVID surge into October. Are we seeing any signs of that surge right now?
No, not at the moment. At the moment, actually, we've seen that our numbers have gone down nicely, and that is supported with wastewater information as well. So, no, we're not really, we're not seeing that at the moment, but, as kids move back into school and as things start to circulate, it certainly could happen. So,
There was some concern from Dr. Teresa Tam about the people who have not kept up to date in terms of vaccinations and concerns that they may have checked out. Is there any plan to, since the system, that data is in the system, you know who has gotten a first and second shot but hasn't gotten a third shot, or it's been maybe 9, 10, 11 months. Is there any plan to actually try and reach out using the contact information, say, hey, we've noticed that it's been a while, now's your time, please come and book, anything like that?
So that, doing that is a bit resource intense, and I don't know that, those plans are in the works at this point. Certainly we do have plans in the works for, a campaign to get people, to make people aware of the need to have a booster vaccination and to encourage people to come out. And we hope by making it broadly available in physicians' offices and pharmacies, that we will see uptake and that people will be able to avail of it in those situations as is convenient for them.
And will the flu shot be offered at the same time? So if folks are getting a COVID booster, they can get the flu shot at the same time? How will that work?
So flu is going to be a little bit later. It usually starts a little later in October. And COVID and flu can be administered at the same time. The logistics of that, though, I can't speak to that right now. We haven't had those conversations. At the moment, these are COVID clinics, and flu won't be offered for about another month or so. It will be the kickoff of that. All right.
Thank you.
We're good. Thanks so much, everyone.
Thank you.
Thank you.